All right. Good morning, everybody here. It's glad to see you all on this. I would call it a little gloomy day, but that's what it is in the winter. Our guest speaker today, Marion Martell, is already here. Some of you might remember she was here last year also and gave a very good talk last year. About 2 weeks ago, I just listened to her talk that she gave in our brain health program, and it was so interesting that I asked her to speak to our seniors in this group also, and she very kindly agreed to come today and give a presentation. For those of you who are not familiar with Marion, that she's on the board of director of patient alumni of University of Ottawa Heart Institute. And her mandate is Women's Heart Health. Currently, she is serving as a Women Health Program Ambassador and a leader of the Women Heart Peer Support. Marion herself, why is she doing this job with so much of passion is, I think last time also she shared with us that she herself was a heart patient. She had a complete heart blockage many years ago, and she was given a permanent pacemaker when she is, with God's grace, healthy today. And that's why she took up this challenge to promote women's heart so passionately. So Marion, I'll not take much time. I also thank you for giving us the permission to record this session, which is being done now. So floor is yours. We have our seniors here. We have some seniors joining from India, from USA, and of course in Ottawa. So please go ahead. The floor is yours.
Oh, thank you very much, Anil, and welcome everybody to our talk this morning on women's heart health, because her heart matters too. I will try to keep this interactive, so I might ask every so often to unmute yourself for a quick true or false question and some things about heart risk factors and signs and symptoms. But just I want to make sure that everybody is aware that this talk is about women's heart health, but it is inclusive. And we want to make sure that men and women of all ages actually learn how heart disease actually impacts women differently than men. And as Anil mentioned in my introduction, I am a heart patient survivor, and some of you might have heard my story last year, and I'm really pleased to see so many familiar faces, so thanks again. So a few years back, I was actually in my 50s, and one day at work, I passed out. And the next thing I knew, there was a firefighter looking at me, and he promptly told me my heart rate was 43, and my normal heart rate is 55 beats per minute. So within a few minutes, the paramedics arrived and they hooked me up to a heart monitor. And there was a woman in the room where I passed out and said, you might want to tell her what you see on the heart monitor, because I used to nurse before, so I'm a registered non-practicing nurse. So the paramedics promptly told me I was in second-degree heart block, and I knew I was in trouble. And I'll explain to you in a few minutes about heart block. So I was taken by ambulance to the civic campus of the Ottawa Hospital, and on my way there, I proceeded from going from second-degree heart block into complete heart block. And then I was transferred over to the Heart Institute, where they first put in a temporary pacemaker, and then they put in a permanent pacemaker. And I solely rely on my pacemaker today to make my heart function. So as a result of my heart health journey, I have become an advocate for women's heart health. And I want to help spread the word on how heart disease impacts women throughout their life. So at this point, am I able to share the screen?
Yes, you can, Marion.
Okay, thank you so much. Whoops. There. So this morning at the end of our talk, you will know what the new 5 targeted key messages are. But first, I want to give you just a brief overview of the Canadian Women's Heart Health Alliance. I'm going to be asking some questions, true or false questions about women's heart health. We'll review the signs and symptoms that can predispose a woman to heart disease. We'll review the risk factors that will predispose women to heart disease. And then I will leave you with the 5 targeted key messages on women's heart health. I do have to read this disclaimer to you. So any information provided in this presentation by your women's heart health advocate should not be considered medical advice and is not intended as a substitute for medical help, advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you have regarding your medical care. And the views and testimonials expressed by the Women's Heart Health Advocate or any other participant are his or her personal views, and the University of Ottawa Heart Institute does not guarantee the accuracy or the appropriateness of the opinions or advice expressed by the Women's Heart Health Advocate. So I want to talk to you a little bit about the Canadian Women's Heart Health Alliance. Some of you on the meeting today, obviously we're here last year, and I talked briefly about the Canadian Women's Heart Health Centre. So I'll just do a quick review on that. In 2013, the University of Ottawa Heart Institute launched the Canadian Women's Heart Health Centre. And the centre was established under 3 thematic pillars. First of all was awareness. The Canadian Women's Heart Health Centre realized we had to increase the awareness of heart disease in women. And the second thematic pillar was research. And the Canadian Women's Heart Health Centre realized we had to improve and do more research on women to determine how heart disease impacts women differently compared to men. And the third pillar was care. And the centre realized we had to improve the care for women with heart disease. So in 2016, there was the first Canadian Women's Heart Health Summit held here in Ottawa. And every 2 years since then, we've had the Canadian Women's Heart Health Summit, which is a national international summit. In 2018, after the 2018 summit, the Canadian Women's Heart Health Alliance was established. And I'm going to be sharing some resources with you at the end, and the resources will be there for the Canadian Women's Heart Health Centre and the Canadian Women's Heart Health Alliance. So this alliance was established in 2018, and the alliance currently consists of over 116 members, which consist of scientists, clinicians, and women with lived experience. And the decision makers in the alliance are working collaboratively to implement evidence, also transform the public and the clinical practices, also impact public policy related to women's cardiovascular health. And under the alliance, there are 4
Marion,
working.
Sorry to interrupt you. Looks like your PowerPoint is stuck at the.
I'm just going to finish that. I think I.
Oh, okay. I'm sorry. I thought
No,
it stuck there.
No,
My
I'm almost
apologies.
there. No, that's fine. I'll just be just another minute. So under the Canadian Women's Health Alliance, there are 4 working groups. And one is the advocacy working group, training and education, knowledge translation and mobilization, and health systems and policies. And that information is all under their website. And it was through the advocacy working group that we established the 5 targeted key messages, which I will share with you. So I just want to briefly review what is heart disease. And I'm just going to ask a couple questions on women's heart health. So the first question, true or false, is heart disease on the rise? And is it the leading cause of death for women worldwide? True or false?
True.
True. You are right. It is true. So when we talk about heart disease is also known as cardiovascular disease, or you might have seen the acronym CVD. And it is a general term for a variety of conditions that affect the heart and the blood vessels. So I mentioned to you a minute ago, my heart disease condition is called complete heart block. So in the atrium, there are little nodes that'll make the atrium contract, and there's little nodes that in the ventricle will make the ventricle contract. So with my disease is that my conduction mechanism is not working. So I totally rely on my pacemaker to make my atrium and my ventricle contract to work. And unfortunately, I think as many of us are aware, heart disease can lead to a heart attack and even death. And we now know that heart disease is a leading cause for women worldwide. And unfortunately, the impact on heart disease traditionally for women has been underappreciated, because when we thought of heart disease or talked about heart disease, we thought it was a man's disease, or we thought it affected people of older age. Well, we now know that heart disease is the #1 killer for women worldwide, accounting for 1 in 3 deaths. And actually, every 20 minutes, 1 Canadian woman dies from heart disease. And we now know that heart disease is a leading cause of premature death in Canadian women. And these are women, unfortunately, who are dying before they reach their expected lifespan. And heart disease, unfortunately, kills 3 times as many women as breast cancer. And really, only about 13% of Canadian women can identify heart disease as being their greatest health threat. And what we're now seeing, there's an increase of heart events among younger women, and those are women between the age of 35 and 55 years. And there's a real increase in heart disease or heart events among these younger women is due to a variety of risk factors and poor healthy behavior. And a survey was conducted on a group of women a number of years ago. And what they wanted to find out from these women, what was their own personal perception of heart disease after they'd been diagnosed with heart disease and treated with heart disease. And a third of the women in this survey said, okay, I've been diagnosed, I've been treated, I can just go back to resuming my pre-diagnosed lifestyle. For an actual fact, when somebody has been diagnosed with heart disease, we now have a chronic condition we have to manage for the rest of our life. So I'm going to ask a few more true or false questions. Heart attack symptoms can present differently for women compared to men. Is that true or false?
True.
False.
False. False.
False. True. Okay.
True.
True. Okay. I've heard a mixture of true and false.
No, it's
False.
true.
True.
False.
True.
True. Okay. It is true for sure that women's symptoms can present differently for women compared to men. So can you tell me what could be some signs and symptoms that a woman could be showing when she's having a heart attack? Can anybody name some signs and symptoms that a woman can present with that she's having a heart attack?
Heartburn.
Heartburn, yes.
It could be backache.
Mhm.
Chest
Yeah.
pain in the
Pain in the chest, arm.
Pain in the chest,
jaw.
jaw. I
Jaw
heard
pain.
back as
Jaw
well.
pain.
I heard indigestion. I think I heard something else just a minute ago.
Short,
Heartburn.
Breath. Breathlessness.
Restlessness.
Dizzy. Feel
Dizzy.
dizzy.
Oh, you people are excellent. Very, very good. Really good.
Palpitation of heart.
Yes, for sure. So here are some symptoms of a heart attack that are most frequently reported by a woman. So when we think of a person having a heart attack, we sort of think of the classic style Hollywood type of heart attack, where the person actually clutches their chest due to crushing chest pain and possibly collapses. And this is not necessarily the experience a woman might have. So most patients presenting with a heart attack will have some form of chest pain or chest discomfort, but women can experience other symptoms as well. It could be unusual fatigue and weakness, sharp or burning chest pain, or shortness of breath. And the symptom that I had a week before I passed out was unusual shortness of breath, and I just contributed that to possibly getting an unusual cold. I did not contribute it to my heart at all. So even though men and women presenting with a heart attack will normally present with some form of chest pain, but the way the woman describes her chest pain, she could say it's tightness or heaviness or squeezing. And the way she describes it can have an impact on her diagnosis and her treatment. And a woman might have less pain, chest pain, or maybe no chest pain, but she could have other symptoms such as nausea, and we see on the screen unusual fatigue or weakness. So you see on the screen that often women will present with some chest pain, but possibly 3 additional symptoms as well. Just remember that not everybody presents the same. And please make sure you speak to your doctor or you go to emergency if you are experiencing any type of discomfort that is unusual for you. So on the screen, you'll see chest pain, pressure or discomfort. It could be sharp or burning chest pain, unusual fatigue and weakness, and as I mentioned, shortness of breath as well. And here are some additional symptoms women are more likely to describe than men. And we talked about indigestion, so upper abdominal pain, abnormal excessive sweating, and we talked about different back, shoulder, or right arm pain, I know somebody mentioned palpitation, which is in a rapid or irregular heartbeat, could be nausea, trouble sleeping, or jaw pain. So today our doctors are becoming more aware that women can present differently having and experiencing a heart attack. But for younger women, the doctors might think that the symptoms that they're experiencing with could be related to anxiety, heartburn, or female issues. And if so, that can lead to less of aggressive treatment for a woman. So a couple more true or false questions. Smoking commercial tobacco and vaping is a risk factor for heart disease. True or false?
True.
True.
True. You're so right. It is true. Because a woman who smokes risks having a heart attack 19 years earlier than a woman who does not smoke. And this one's a little bit of a trick question. Heart disease and exercise are not related. Is that true or false?
False.
Oh my goodness.
False.
You
False.
people are great, fantastic, because physical inactivity or lack of regular exercise is clearly shown to be a risk factor for cardiovascular disease. So can you tell me what could be some of the risk factors for heart disease that a woman should be aware of? Anybody, risk factors?
Obesity.
Obesity, correct?
Sedentary lifestyle.
Sedentary lifestyle,
Blood pressure, high blood pressure.
high blood pressure, you're right.
Stress. Drinking.
Diet,
Diabetes.
Stress also
Diabetes.
can cause.
Eating too much
Diabetes.
fat.
diabetes,
Family
and-
history. Family
and-
history.
and
High blood-
family history,
High
you-
blood pressure.
high blood pressure. You people are great. You know what your risk factors are. So when we talk about risk factors, these are the behaviors or the conditions that will increase a person's chance of developing a disease. And 9 in 10 Canadians likely have one risk factor for heart disease and stroke. And so it's really important to identify the risk factors as soon as possible in order to prevent or reduce any further damage. And here's something we all need to know, because I wasn't aware of this, that risk factors for cardiovascular disease can be and are present as early as age 20. And we also know now that heart disease affects women of all ages, and there are different risk factors for a woman across her lifespan. So the 4 risk factors that you see on the screen in front of you, these 4 risk factors are risk factors we cannot change. And they're called non-modifiable risk factors we cannot change. So the first one is age. So as we get older, our risk of heart disease increases. We know that the heart is a major organ and a muscle. So as we get older, it becomes weaker and slower. Sex. For the most part, men are at a higher risk of heart disease much earlier in life than women. But that difference narrows actually after a woman has reached menopause. So after the age of 65, the risk of heart disease becomes very similar for both sexes. Ethnicity. There are certain ethnic groups actually, because of their genetic makeup and environmental influences, are more predisposed to heart disease. And these are Indigenous people or individuals of African or Asian descent. And there's a higher prevalence of heart disease amongst these cultures due to a higher prevalence of diabetes and high blood pressure. And I did hear family history. Family history is a strong indicator for heart disease. So if we have had a first-degree relative, that is a father or a brother who had a heart attack or heart disease before the age of 55, or if we've had a mother or a sister who've had a heart attack or heart disease before the age of 65, this puts us at a high risk of heart disease, and it actually can double our risk of heart disease because we share the same genetic makeup. But there is some good news, okay? So just remember this, that 80% of heart disease is preventable by managing the risk factors that are within our control. So as you can see on the screen, these risk factors are within our control, and if we're able to manage them, we can prevent, or largely prevent heart disease. So the first one, and I think most of you have mentioned these risk factors, so thank you very much. So the first risk factor is high blood pressure. So high blood pressure has also been known as hypertension. So if a person has high blood pressure, unfortunately, that makes our heart work harder. It can cause excessive damage to our coronary arteries. It can cause a trigger of plaque to build up in our coronary arteries. Our arteries can become stiffer, can reduce our blood flow, and unfortunately, that will contribute to heart disease. And a person that has high blood pressure, it's also been referred to as the silent killer. And the reason is that many people very rarely have a symptom or experience symptoms that they do have high blood pressure. So it's important when you're talking to your doctor that you know what your blood pressure is for you and what is normal for you. Because unfortunately, if a person has high blood pressure, this can actually double or even triple our risk of heart disease. High cholesterol is another risk factor. And cholesterol is a type of fat that is produced by the liver, and it's found throughout our body. And we can also get cholesterol from the fat that is contained within our diet. But not all cholesterol is bad, because we do need a bit of cholesterol to build up our body cells. But too much cholesterol is a problem. So there's two types of cholesterol. The first one, the acronym is LDL. So that's low density lipoprotein, or lousy cholesterol. And this causes a buildup of plaque in our coronary arteries. But there's good cholesterol. The acronym is HDL, or high density lipoprotein. And this good cholesterol actually disposes of the bad cholesterol. So just remember, again, when you're speaking to your doctor, you want to know what is your cholesterol level, and is that normal for me? Diabetes is the third risk factor for heart disease, and people who have diabetes put them at a very high risk of heart disease as well as stroke. So diabetes is when our blood sugar or our blood glucose level is too high. And there are 4 types of diabetes. The first one is being a pre-diabetic, and this is when our blood sugar is just a little higher than normal. Then there's type 1 diabetes, and this is where the body does not make enough insulin. Type 2 diabetes, which is quite prevalent, is where the body cannot use the insulin properly. And gestational diabetes, this is where a woman develops diabetes during her pregnancy because not enough insulin is being produced. So again, when you're talking to your doctor, you always want to ask, what is my normal blood sugar level? Smoking, we know that no amount of smoking is good for anybody, because unfortunately, smoking has a negative impact on our blood pressure, our cholesterol, and smoking does make our heart work much harder. And psychosocial factors are now pre-existing risk for heart disease. And those are negative emotions such as stress, anxiety, depression, anger. And these negative emotions unfortunately affect the heart, because the heart can become irregular, our blood pressure can increase, our fat cells can be converted into cholesterol, and our platelets can become sticky and build up in our arteries. And the last one is overweight and obesity. And now they consider overweight and obesity a chronic progressive disease, very similar to diabetes and high blood pressure. So I know there's many factors that can contribute to overweight and diabetes, such as it could be medical problems, certain medications, it could be emotional health, lack of sleep. But it's really important to know if you are at a risk of overweight or obesity. And what they look for is our waist circumference. Our waist circumference is really an indicator associated to health risk. And what they're looking for is excess fat around our waist. So if a person has a waist circumference greater than 88 centimeters or 35 inches, this is associated with a number of health problems such as type 2 diabetes, heart disease, and high blood pressure. So what they want us to focus on today is what is a person's best weight? And how can we maintain a best weight by making healthy food choices, being physically active, and taking care of our psychosocial health? So are you at risk? So many women do not realize that their risk of heart disease substantially increases depending on the number of risk factors they have. So if you have one risk factor, this equals to 2 times your risk of heart disease. If you have 2 risk factors, this equals to 4 times your risk of heart disease, and 3 or more risk factors equals to 10 times our risk of heart disease. So it's now recommended for men and women over the age of 40 to have a complete cardiovascular risk assessment done on them every 5 years. So what I want to leave you with are the 5 targeted key messages. And these have been developed by the Canadian Women's Heart Health Alliance by the Advocacy Working Group. And these 5 key messages are being translated into 12 different languages, as well as we're doing videos on these 5 key messages in the 12 different languages. So they're being translated into English, French, Algonquin, Inuktitut, Plain Cree, Ojibwe, Creole, Spanish, Portuguese, Chinese, Hindi, Punjabi, and Arabic. And right now they've been translated into 11 out of the 12. So we have Tagalog, Punjabi, Portuguese, Hindi, Spanish, Creole, simplified Chinese, traditional Chinese, Arabic, French, and English. And really, we would love you to disseminate these 5 targeted key messages amongst many different cultures so that they get to know the risk factors for heart disease and how they can manage their health. And also, we want them to be disseminated amongst different socioeconomic individuals as well. So this is a snapshot of the 5 key messages. So first of all, we did speak already that heart disease is on the rise, and it is the leading cause of death for women worldwide. So heart attack symptoms are not recognized in over 50% of the women. The cause of heart disease can be different for women than men, and women can be at a greater risk for heart disease than men. There is a lot we can do to help reduce the risk, because heart disease is largely preventable. And to take care of others, you need to first take care of yourself. So start the conversation with the women in your life. So key message number 1 was, we just mentioned, heart disease is on the rise and is the leading cause of death for women worldwide. And the graph in front of you has been produced by the World Health Organization. So you can see on the graph the increase in Canadian and the States of heart disease in women. Key message number 2, heart attack symptoms are not recognized in over 50% of the women, because we did speak about a minute ago that women can present differently having a heart attack compared to men. And these are the symptoms that are most often reported by a woman, which is chest pain or discomfort, pressure, tightness, burning, pain in the jaw, arm, neck, and back, abnormal excessive sweating, shortness of breath, stomach pain or discomfort, feeling of nausea or indigestion. And then we also, for women, we also have some accompanying associated symptoms as well. And it could be unusual weakness or fatigue, back, shoulder, or right arm pain, sleep disturbances, dizziness or lightheadedness, fast or irregular heartbeat. So when we ask the question, the people in the audience today are quite aware of the different symptoms that a woman can present with. So I'm really pleased to hear that. And for women, sometimes we will present with 3 or more symptoms in addition to our chest pain. So please remember, when in doubt, check it out. It's important that you seek immediate and medical attention if you think you're experiencing a heart attack. Key message number 3, the cause of heart disease can be different for women as compared to men. And here are some common causes for heart disease: coronary artery disease, valvular heart disease, arrhythmia, which is an irregular heartbeat. And here's some causes that are more likely for women as compared to men. And that's spontaneous coronary artery dissection, coronary vasospasm, microvascular dysfunction, which is a small vessel disease, Takotsubo, and this is a stress-induced cardiomyopathy, which is a disease of the heart muscle. And peripartum cardiomyopathy is a weakened heart during or after pregnancy. And key message number 4, women can be at a greater risk for heart disease than men. And as we mentioned earlier, heart disease affects women of all ages, but there are certain risk factors that can affect a woman across her lifespan. So the following conditions lead to a greater risk for women with heart disease, So the first one is certain pregnancy conditions and complications, because a pregnancy is like a 9-month-long heart stress test. So if a woman has complications during her pregnancy, such as premature birth, delivery before 37 weeks gestation, or if she's developed diabetes or hypertension or preeclampsia during her pregnancy, this can predispose her to heart disease. And preeclampsia is a pregnancy complication characterized by high blood pressure and signs of damage to other organs. Early menopause. So the average age for menopause is 50 to 52 years of age. But if a woman reaches menopause before the age of 45, this will increase her risk of future heart disease. And polycystic ovary syndrome, this is a hormonal disorder that can be common among women of reproductive ages. So again, if a woman has had any problems with ovarian problems, again, this can predispose her to future heart disease. Systemic inflammation and autoimmune disorders for women, such as rheumatoid arthritis and lupus, can again predispose us to heart disease. And cigarette smoking, we did talk about that a minute ago. Women have 3 times a higher risk of heart attacks due to cigarette smoking compared to men. And diabetes, we talked about a minute ago. So women living with diabetes are 3 times more likely to die from a heart attack compared to men. So some of the risk factors that are contributing to heart disease for both men and women, for women, some of the risk factors are greater for women compared to men. And key message number 5, there's a lot we can do to help reduce the risk, because heart disease is largely preventable. So just remember that 80% of heart disease is largely preventable. And those are the risk factors such as high blood pressure, high cholesterol, diabetes, smoking, psychosocial factors, obesity, and overweight. So it's preventable. First of all, it's important that we become active and keep moving. So they recommend 30 minutes of physical activity a day, up to 150 to 200 minutes of physical activity per week. And if you're not used to doing some sort of form of physical activity, you might want to start in 10-minute increments. So you might want to start only with 10 minutes a day, and can you work that up to 30 minutes a day? And I know with COVID, it's been very challenging that a lot of us have been sitting more and moving less because we're doing a lot more meetings on the computer. So it's important that we do sit less and move more. And you want to eat a variety of healthy foods. So again, you want to have legumes in your diet. You want to have grains in your diet, fish at least twice a week in your diet. It's important that we cook at home more often than eating out, because sometimes when we eat out, we don't know the sugar, the fat, or the salt content. Also eat regular meals. And they're recommending 7 to 10 servings of fruit and vegetable a day. But just remember, a serving is only half a cup. And it's important that we manage our stress. Deep breathing exercises are good. Muscle relaxation exercises are good. Visualization exercises are good. Yoga are good to try and help manage any stress that we could be experiencing. You want to live free from commercial tobacco and vaping. You want to limit your alcohol intake. And you do want to get regular checkups for your blood sugar level, your blood pressure, and your cholesterol. So these are the resources I will be sharing with Anil, and he can actually share them with you. So the Canadian Women's Heart Health Centre, yourheart.ca. So on this website, you'll learn about all the risk factors that predispose women to heart disease. You'll learn about the symptoms, signs and symptoms that a woman can experience having a heart attack, and there's different infographics there. There's also a number of questions that you can ask your healthcare provider, because often I hear that a woman goes to the doctor and sometimes they say, I just don't know what to ask the doctor, which I totally understand and can relate to. So on this website, there's a number of questions that you can actually jot down to ask your healthcare provider about your condition. The Canadian Women's Heart Health Alliance, which I spoke about today, that is their website. And when you go onto that website, you will get information on all 4 working groups. The University of Ottawa Heart Institute website, ottawaheart.ca. I've been asked a couple times, how can more women volunteer for research? So if you go on to the Heart Institute website, under patient and visitors, scroll down And there's an area where you can say engage in clinical research. HeartWise webinars, these are free webinars that are put on by Prevention and Wellness at the Heart Institute. And all past webinars are there, so you can go onto this website at any time and watch these webinars, and they have valuable information for everybody. And Kathleen Turner, who is the registered dietitian at the Heart Institute, I've shared with you a link there for healthy eating. And Canada Food Guide is a great form of diet because it's more plant-based now, but also if you go under Canada Food Guide Snapshot, this food guide is offered in different languages. And here is some links. So the first link is for the different multilingual resources of those 5 targeted key messages that are being translated into those 12 different languages. So please take a look at those and please share those resources. The one underneath, also the Canadian Women's Heart Health Alliance is now trying to, we've created a lesson plan because we now want to educate the young adults in our life. So there's a lesson plan and a toolkit for teachers and students, and they're getting into the classroom for grade 8s to grade 11 students. So if you have any family members or friends that are teachers, we actually want to educate the young adults in our life about, first of all, how heart disease impacts women and also heart disease in general. And then the last 4 links, in order to manage our risk factors, it's important to manage our emotional health, exercise, eat healthy, and manage our stress. And those are 10 tips for each. So I will be sharing those with Anil, and he'll share them with you. So in closing, I really want to thank you very, very much for your time. So I'll turn it over to questions and back to Anil.
Okay, thank you, Marion. Wonderful presentation. And the best part of it that I liked was that it was explained in a very, very simple terms. There were no heavy medical terms used, no jargons, nothing. Very simple to understand. That's very much appreciated. And if you have any questions, please raise your hand and we'll go one by one. If anybody has any questions about our presentation, the floor is open.
Don't be shy. Every question.
The other reason, Marion, could be that it was so nicely explained that everything is clear. They don't have any doubts about it. But
Okay,
we do have one question, one hand raised.
I see a couple hands. So do you want to moderate this then, Anil, please?
Yeah, I'm going to do that one by one. Sunita ji, raise your hand digitally, please. Jagjit Khosla, please unmute yourself and you can ask your question.
Yes, thank you very much for a very interesting seminar. One question, that since the symptoms for women are more confusing and one can be easily mistaken that whether it's a really heart attack or just something that I don't like, for example, weakness or fatigue, I'm just not feeling good. So how do you distinguish that you have a heart, or distinguish that you need to go to an emergency?
Okay, that's a good question. Because yeah, some of the symptoms are unusual, extreme fatigue, could be dizziness. You really have to ask the woman in your life, is this something really different that you're experiencing today from what you experienced yesterday or the day before? Because a woman knows their normal body and how they're feeling. So when she starts experiencing something unusual, she really needs to take note of it, and her family members need to take note of it. So if it's to distinguish between whether we need to go to the hospital or not, the key thing is, as I mentioned, when in doubt, you want to make sure you check it out. Again, if you think it's serious, don't drive yourself to the hospital. Make sure you call 911 or have somebody drive you. If you don't think it's quite as serious, there's no harm in putting a call into your doctor to verify it. And also make sure your doctor is aware if you have any risk factors, predisposing risk factors, or if you have any family history. So make sure your family doctor knows about your family history of any current risk factors or any family history, because when the woman starts feeling differently, then possibly it is being predisposed to a heart condition. Did that help you?
Yes, certainly. In my personal case, I had a heart attack in the middle of the night, and got up and just felt a little bit uneasy. And I felt, so it was a bit, dicey whether should I be calling, ambulance or not.
Just please remember, as I'll repeat again, when in doubt, check it out. Because if you call 911, okay, which is great, the ambulance will come and assess you, okay? And if they don't think it's necessary to take you to the hospital, they won't. But at least you're going to be looked at, okay? You're feeling different. You're not feeling the same. Something is happening in your body. You can't put your finger on it, but this is not the way I normally feel. Just call. Don't delay, okay? We all know our bodies, and we need to seek help, because unfortunately, as I mentioned, every minute is critical, not only to our survival, but we don't want to create any damage to our heart muscle.
Thank you.
Oh, you're welcome.
Thank you. Sunita Gandhiji, you can ask your question now.
Firstly, I would like to thank Marion for a comprehensive talk covering almost everything in a layman's language. It was very, very helpful. Could you expand a little more on the conduction mechanism, the word you used regarding your problem?
Yeah.
That help. Thank you.
Okay. Oh, no problem. Yes, because when I say complete heart block, what somebody think I have is that my arteries that supply the blood to the heart are blocked. And that can be, so some people, when they go to the doctor, they say, your coronary artery is 90% blocked. So they need to either require surgery or they need to require a stent to unblock that coronary artery. So mine was called a conduction block, so complete coronary conduction block. So there are little nodes. So there's vascular problems for the heart. So the vessels, there could be damage to the vessels that affect the heart. And then the heart also has a conduction mechanism. So the conduction mechanism in my case was affected. So there, as I mentioned, my problem was conduction. Some problems are vessel, some problems are valves, some problems are muscle. So mine was conduction, because those little nodes that are in the atrium make the atrium contract to beat, and then little nodes in the ventricle will make the ventricle contract and beat. So I have a pacemaker battery with a wire going into the heart to make it conduct. So there's conduction problems, vessel problems, muscular problems, valve problems. Those are all different conditions of the heart. Did I explain that clear enough to you?
Conduction means something to do with electrical thing?
Correct.
Electric mechanism of the heart stopped.
Correct. That's totally correct.
Thank you. That's what I needed to. Thank you very much.
Sometimes it'll
Thank you.
completely stop. In my case, it did completely stop. And sometimes be careful, because your heart rate can slow down. And that means that possibly the conduction is not quite right. So just be careful of if it slows down and you become lightheaded or dizzy, just make sure you check your pulse, your heart rate. Okay. Did I confuse you with that? Sorry.
Okay. Thank you. I saw Urmil Waliaji, you were trying to raise your hand. If
Thank
have
you.
a question, Hanji.
Thank you. My question would be about a vegetarian alternative for fish.
Okay. You're wanting me to give you an alternative fish? So you're a vegan or a vegetarian?
Vegetarian.
So vegetarian, correct me if I'm not. So vegetarian, can you not have fish? No? Okay. So
Not
no. So you want to make sure you get protein, right? So I don't know. What about tofu? Can you have tofu? I don't
yes.
know.
Yes,
Okay,
he can
so-
have tofu.
Who would
Beans, kidney
be okay.
beans.
And beans and your legumes, right? All help. Nuts as well, but you want unsalted nuts. Yeah, so like I have a vegetarian chili that I cook with all beans. But you certainly want to make sure you get protein into your diet if you're able to. And so those are some substitutes, and I appreciate people giving me a hand with that. Does that answer your question?
I think her video, she's frozen.
Yes, thank you.
No,
Oh.
she can. Okay.
Okay, you're very welcome.
Thank you. Sneh Bhallaji, please go ahead.
Thank you, Marion, for a very nice presentation. My
My pleasure.
question is, once you are diagnosed coronary artery disease, do we have to eat medicine rest of the life, or we can stop in between? Thank you.
Normally, once you've been diagnosed with heart disease, you will likely be medicated for the rest of your life, but you will be monitored, okay? And the doctor will assess you regularly, and the doctor will assess the medication you're on regularly. And at some point in time, the dosage might be able to be decreased a bit, or it might have to be increased a bit. But normally, once you've been diagnosed, and depending on what your diagnosis is for coronary artery disease or heart disease, you will likely to be on medication. Yes.
Thank you.
Good.
You're welcome.
Mithilesh, please go ahead. Unmute yourself, Mithilesh, please. Mithilesh, please unmute yourself.
Yeah, I'm sorry. I'm sorry. Yeah. If the irregular heartbeat, sometimes is up, sometimes is low. And so otherwise the blood pressure is fine, and blood pressure measure it is fine. But the heartbeat is sometimes low and high.
Have you spoke to your doctor about that?
Yeah, we talked to,
Sorry?
he suggested about the pacemaker,
Yeah.
but still the institute did not reply, so waiting for that.
So you've been in touch with your doctor regarding your symptoms.
Yeah,
And he has referred you to the Heart Institute or a cardiologist?
yeah, Heart Institute, yeah,
And you're still waiting to hear?
yes.
How long ago
And
was
it
that?
is long time, it was almost a year.
Uh-oh. Uh-oh. Okay. Okay. When did you last see your own doctor?
No, after that, I did not ask anything.
Okay.
It's
You
okay, everything is fine, but sometimes the heartbeat is up and sometimes is low. And if it is up, it goes down quickly too.
You really need to get back in touch with your doctor very
Okay,
soon.
thank
Very
you.
soon. You need to speak to your doctor very soon and tell him what you're experiencing, because if it gets too low, we don't want you to pass out. Do you have
No,
family
it is-
around?
It is not too low, it is 50, 49 sometime. Sometime is high, you know, very, very high, and sometimes is low, and it automatically up and down, no, nothing in between,
nothing-
you know.
Okay. So when did you last see your own doctor? Sorry?
We have not gone, you know, long time because it is corona and just we talk on
But
phone.
you need to talk to them. You need to at least call your doctor.
Yeah, I will talk in Mondays coming soon. Yeah.
Yes. Sooner than later.
Thank you.
Sooner than
Thank
later.
you. Thank you.
Okay.
So what is the reason? Do you know, do you understand me?
I know what you're telling me, and I understand what you're telling me, but you do need to be assessed, and you need to be very honest with your doctor when you talk to them today, when you call them today, that you're having this irregular heartbeat. Sometimes it's slow, sometimes they need to know that you are symptomatic.
But symptomatic?
You're having symptoms of a low heart rate, because
Yeah.
you can feel it, and you have symptoms of a heart.
But I don't feel any problem, you know, for that.
Well, you notice it though, don't you?
Yes, I know, but by my wristwatch, by my Fitbit, I know that.
Yeah, yeah. But you need to speak, yeah. So to answer your question, what is actually causing that to happen? Again, the
Yes.
doctor would have to explain what could be causing it.
Okay, thank you.
All right. Looks like there are no more questions now, Marion. Before we end the session, I would again like to thank you very much for this presentation. You have always accepted our invitation, and we hope to have continue to have your support in future also. Thank you very much. We'll continue with our routine program now. And if you feel like, please stay on and enjoy the
Okay, well, listen, thank you very, very much. I really, really appreciate it. You have a very, very proactive group, which I'm really pleased to see. Pleased to see that people are, asking questions about their health, making sure they check their health, make sure they speak to their doctor. But I'm really pleased to see that you've got quite an active group, and your attendance is fantastic. Also, I'm very pleased to see that men are here, as I mentioned earlier, because it's not only women that need to know, the loved ones in our lives need to know as well. So thanks again for having me, Anil. Reach out anytime. Always glad to help.
Pleasure.
Marion.
Thank you. Thank you so
Okay.
much.
Okay, thank
Thank
you.
you so much.
Thank you.
Thank you.
Okay. Oh, you're welcome. Okay.
Thank-
Bye-bye.